I'm Ladd Williams of J. Ladd Williams DDS. I'm a cosmetic dentist in Mesa, Arizona, and I've been using Joey for a while to do some internet advertising, and it's working pretty good.
Awesome. So, kind of just to kick things off, Doctor, can you kind of just briefly describe, I guess, what the practice was involved in terms of advertising and marketing before we kind of met, and kind of how things have changed since then?
Okay, so I was heavily into SEO, search engine optimization, and uh, Yelp and 1-800 Dentist, and I still do some of that stuff. But going through the Facebook advertising with Joey, I get a lot more hits. And people seem to respond to that a whole lot better, and it's a whole heck of a lot cheaper to do. So,
Awesome. And if you could kind of just go in a little bit more detail, what did you feel was, I guess, missing from the Yelp advertising or the SEO? Like, what weren't you guys getting, and kind of what could have been improved just from these other forms of advertising that we've kind of been implementing for you, specifically with the Facebook advertising as well as the automation follow up and things like that.
so with Yelp or 1-800 Dentist, you're just in a pool of other dentists, and they just kind of rotate through, and you get hit or miss, whoever it is, and they just send you an email, and then you got to respond to it. And with your format, it's specific for me, and then the people respond directly to me, and then there's an automated response back. So definitely get much better follow up on that end of it.
Gotcha. Amazing, amazing. So I guess I think originally hooked up. I think it was through just email. I think I had one of my assistants reach out to your office manager, and you were kind of skeptical at first. You're like, I don't know who you are. I don't know you from Adam. How do I know you're going to get results from me, right? So I think we agreed on an initial, like, a 2-week trial
Yeah,
just to improve the worth. And can you kind of discuss, what we were able to achieve just during that 2-week window?
yeah. So during that week, I don't remember exact numbers, but we got quite a few leads. I don't remember. Maybe it was 6 or 8 or 10 or maybe even 12, but it was pretty impressive. And one of them actually came in and ended up doing a whole bunch of work. So it's like paid for. It was great.
Yeah, if I remember correctly, I think it was like I don't know, something absurd, something like in the realm of like 20 grand in
Oh,
potential billings, or I'm not
oh
really
yeah,
sure
yeah.
exactly.
One person, they came in for bleaching and ended up doing it was like 18 grand worth of dental work. So
Oh,
worked out
wow,
all right. Yeah.
that's great. Yeah, I think you said she brought like her entire family in and a bunch of
Yeah.
referrals.
Well,
Um,
that was yeah, and that was a different patient. So yeah, so we've had several of them that have done that. So yeah.
Gotcha, gotcha. And I guess, why specifically was growing the cosmetic dental side of the business important to you? Like, what has that allowed you guys to do now?
Well, so that's what I focus on anyway. I, I'm a general dentist, and I can do the general dentistry things, but I've done a ton of training in the cosmetic end of it and the full mouth reconstruction end of it, and that's where I'm happiest. That's where I love doing it, and people actually are happier writing a check for more money for more dental work than rather than complaining about paying. I got to pay for a root canal or I got to pay for a filling. It's kind of funny how they'll happily pay for something to make them prettier. So
Right, right, right. That cosmetic appeal. Um,
vanity.
Yeah, exactly. It's all vanity, all vanity. And how would you say, I guess, like, being able to target, I guess, condition-specific treatments such as veneers or teeth whitening or other cosmetic services? I mean, can you just kind of describe in your own words how that has kind of helped you, I guess, grow the practice and kind of just target the exact or ideal perfect patient that you guys are looking for?
And what makes it nice is if you're using those whatever terms you want, whatever you're looking for, they self they filter themselves out. So they're looking specifically for that particular, whether it's veneers or cosmetic work. That's what they're looking for. You're not getting people say like through another search engine, which would be pain or I've got this toothache, which we can totally take care of. But these are people that are specifically looking for at their own time through Facebook as they're scrolling through. They're thinking about veneers or they're thinking about cosmetic work, and if, so it's nice because they've already pre-chosen themselves for that particular work. And well, all I have to do is come in and say, yeah, this is how, this is what you need, and this is how you can do it.
Right. Yeah. I mean, all the attention nowadays is on Facebook, it's on your mobile device. So, that's where you need to be. Right. I mean, if
Right.
you're not, you're probably missing out on a lot of business that you could be getting.
Yeah, search engine optimization, as we all know, if you search in any topic, the the first 5 or 6 slots are all taken up by ads, and
Yep.
I don't think anybody looks past the ads, and you pay dearly for those ads. So
Yeah. It's a pretty penny to Google.
yeah,
So it's nice to kind of swoop in at that lower cost per
right.
patient, with
Yep.
Facebook, of course.
Yep.
Awesome. And then any last comments, I guess, if you want to kind of share with, your fellow dental friends or, just our audience, just kind of any last comments of kind of, would you recommend the service? Just advice to, your dental colleagues.
Yeah, I think I've never. Again, this is the first time I've seen your face. Great to work with. Very reasonable. Respond back quickly and get things done really easily. All I have to do is make a phone call here or there, and Joey gets it done, which makes it nice so that I can focus on other things. So it's the easiest advertising I've done. So yeah, I would
Awesome. Well,
recommend it. Yeah.
awesome. Well, we've been very, very thrilled to serve you thus far. Excited to kind of jump into 2019 with that momentum and, carry it into the new year.
Yeah,
Awesome.
be good.
Well, thanks for the time, doctor, and I will be reaching out to you shortly.
Sounds good.
All right, take care.
You too. Thanks.